Hello, today I'll be demonstrating how to start an IV, and I have my doctor's orders here, and doctor's orders make sense because the patient will need access to administer medication and also fluids. So I'm going to gather my supplies. I have my needle with catheter on there. I'm going to have my saline flush. I have my IV starting kit, and I have my IV line. I also have my tape here. And so I'm gonna gather my supplies, and then I am going to go to the patient's room. Good morning, I'm Eddie. I'll be your nurse, and I'm doing hand hygiene. Can you tell me your name and date of birth? And I'm looking at his wristband, and he is stating first name, last name, and date of birth, and they do match, and they also match with the doctor's orders as well. The reason why I'm here is because I'm going to start an IV on you. Do you have any questions about that? I'm going to give the patient some patient privacy, and do you have any questions about the process? No. Have you had an IV before? Yes. Do you have anything like a port or anything of that nature in your body that would enable me from using that part of your body at all? No. Okay. And usually, where have you gotten your IV put before? Forearm. So at this point in time, any preference in which arm? Okay, so I'm going to do it in the right forearm. That's where we're going to start. So first, I'm just going to check and feel to see if I can find the vein. I already brought the bed up to a nice working position, side rail down. I said I've done hand hygiene, and I am going to put on the tourniquet to feel for that vein. And I'm feeling for the vein, and yes, I can feel a nice, good, what appears to be a really good vein right in the forearm, which is medium cubital vein. So I'm going to go ahead and release that, and I'm going to do hand hygiene again since I was touching the patient, and then I'm going to get my equipment ready. I'm also going to glove up. And I'm going to start prepping my stuff. So get my saline ready, and I'm going to go ahead and open my IV line, and I'm gonna go ahead and connect it to my saline, and then what I want to do is I'm gonna go ahead and flush it. Be sure there's no bubbles and water is coming out of the other end, and I'm gonna leave this as is, and I will put it back in that sterile container where it came in until I'm ready to use it. Then I'm going to open the this kit here, and I'm going to open my kit, and I have my needle as well, and I'm going to prep that needle, and so I am going to remove, and then I'm going to make sure that this is loose and it's not stuck. I will put the cap back on, and I'm also going to remove, okay, I don't remove anything in the back. So everything is good. for my use. So now I am going to break my chlorhexidine, and I broke it, and then I'm going to start prepping the site, and I'm going to scrub about 2 inches all the way around the puncture side. I'm going to scrub real good, and that is done. So I'm gonna, this is trash, and I am going to let that dry. Meanwhile, I'm letting that dry. I gotta make sure that this is loose for me to use when I'm ready for it, and already fully dried. So I'm gonna go ahead and put the tourniquet back on and get the patient ready to set the IV line. Okay, I see that the vein is bulging up, and I am going to try to hold the vein in place so that it doesn't roll, and I am going to go in. I see a flash right there, and now I am going to occlude the vein so that I'm gonna pull the needle out and insert the catheter, but it won't go all the way to the hub. And then this is going to go in the sharps container, and I am going to grab my IV tubing and connect it here real tight, and then I am going to release my tourniquet, and I am going to flush and hold it and feel to see if there's any infiltration, and look, see if there's any swelling or anything happening as I flush with saline. I don't see anything. Do you patient have any discomfort? I'm gonna go ahead and lock it. I'm gonna go ahead and lock it, and I'm gonna disconnect that. And while I'm holding it now, I am going to clean the area if I have any blood or anything that came out while I was trying to connect the IV line. I don't have anything. I'm going to put my occlusive dressing, but before I do, I'm going to put a small piece of tape right here to hold this in place. Then I can have my hands free, and I'm going to place this like so. And I'll remove the paper. Are you doing okay, sir? Yep. Okay, so I'm going to keep this because it has a label which I am going to use to put my initials and date. And 22 gauge. All right. Then this is going to go at the bottom of the dressing. There we are. That is trash. Now I'm going to finish taping my line here, make it safe and secure. Okay, and that is pretty secure. Have removed the tourniquet completely, and like I said, I flushed everything. Patient had no complaints. I didn't see any swelling or any indications of infiltration. There's no bleeding around the site. Do you have any questions? Patient doesn't have any questions, so I'm going to go ahead and raise the bed to a nice and comfortable position. I will raise the side rail. I'll give the patient call light to call me in case he needs anything. I said the needle went in the sharps container, and all my trash in the trash. So I'm going to do hand hygiene, remove the curtain, and go document. And for documenting, one of the things that I'll be documenting is how the patient tolerated the procedure. Patient tolerated the procedure well. There was no signs of infiltration. There was no swelling. There was no redness around the site when I left, and patient did not complain. Blood was present, and when I flushed, there was no resistance, and everything, there was good flow. That is that, and I am done.